Well, what is important about the migraine is that migraine is a very prevalent, right? So we know about the prevalence of migraine, and we know that if you don't treat migraine, this will have a huge impact on patients' quality of life, and the consequences not just attacks and let's say personal cost of the migraine for each individual suffering from migraine. It is also societal burden, because it costs a lot for the society. Sick leave days, consequences for the family, consequences of planning the career. And we also know that the migraine is more frequent in women compared to men, and it usually strikes in the most productive years of their lives, right? Between, let's say, 20 and 50 years old, in this age range. And what we also know from the global burden studies, that particular this period, we have patients, migraine ranks as a #1 cause of disability, years lived with a disability, particularly in this group. So you can imagine that the burden of migraine is huge. And the problem is that also after so many years, let's say education, awareness, still we see a lot of patients underdiagnosed and undertreated. What does it mean? We have a lot of patients not receiving, let's say, sufficient efficacious acute medication and also preventive medication. And what we have also now, what advantages we have now, that the adherence with the new medications, with the class of medications, especially preventive medications I'm talking about, much, much better compared to the drugs that we used before, unspecific drugs. So that's why burden, diagnosis and treatment goes together. That's why it's important to remember that. So each patient, each individual, we talk about that personal costs and also consequences for the family, consequences for career, for consequences for society. So it's a huge impact.